on with that. And how's med school going? Like I said, it's good until it's not. That's always how everything is, right? So, so far, I think right now I'm number one in my class. Um, I've pretty much crushed every class I've had so far. Again, I'm a second year now, so I'm an MS2. So I should be taking STEP at the end of this year. It's a lot, it's busy. It's very busy. My school is mandatory attendance, so you have to be in class from 8 to 5. So that's a lot. And particularly if your professor doesn't teach in a way that's beneficial to you, which isn't always the case. I've been lucky so far. Most of my professors I can listen to and absorb, but I know a lot of people don't learn that way. So, if they're forced to be in class for 8 hours versus them using a third-party resource that's better for them, that just adds more time for them to have to study onto that. I've been able to develop a system over the years that is sort of an in-between generations, I guess. Like I treat the school as a job, so I really try to focus while I'm in class to get as much as I can out of it. And then for the exams, I mostly will use the professor's slides. And what I'll go through is I'll look at a slide and I'll make 3 or 4 Anki cards myself out of it. And I'll use speech to text. So I'll look at a slide and I'll look at it and I'll be like, okay, what are the questions that a professor could ask me out of that, right? Like, so if I see a bunch of interleukins, I'll say, what's the interleukin that's most responsible for fever? And then my answer will be IL-1. And I'll say, okay, what's the interleukin that's most responsible for acute phase proteins from the liver? And it'll be IL-6. Or it'll be like, what's the icosanoid that's most important for vasodilation and inhibits platelet aggregation, right? And it would be PGI2. And I have to differentiate that from PGD2 or other things like that. So I'll make flashcards of them. And the process of making that flashcards for a test or a quiz usually take 4 or 5 hours, I think. And then I'll try to get through that. If I get through that, it'll make 400 or 500 cards out of that. And if I get through that maybe 3 or 4 times, then I'm pretty sure I'll get an A on the exam. If I only get through it twice, I may be high Bs. And if I only have a chance to get through it once, like say you have 5 exams in 4 days or something like that, so you only have 1 day to go over your cards. Now we're looking at, low B raw scores. So at our school, they do curve the final exam a little bit, for better or for worse, like I said, Caribbean students tend to not score quite as well on standardized exams. So the class average is usually below the national med school average, which is not a surprise, right? Like US med schools have the best of the best students. These are kids that all have 4.0s, by and large, and 515 plus MCAT scores. So they've demonstrated that they're going to be good test takers. And a lot of times, some of the more rural DO schools and the Caribbean schools, they have folks that are just not as good of test takers. That doesn't mean they're not as smart. They just don't specialize, quite well in those kind of exams. And unfortunately, because some of these schools do curve the exams, I think it lulls some of these students into a false sense of security that they'll be able to pick it up when they get to MD5. And so they could be scoring 15, 20 points below passing and still passing the class. And the thing is, if you're accumulating a 15-point deficit every single class, that accumulates over time. And you're not going to be able to learn all that and review everything else at the last second in MD5. So they end up having to, take the in-house comp exam multiple times, which can really delay their move into clinicals. So, knock on wood, hopefully I'll pass it on the first time. I've cleared all my NBMEs by at least 10 to 15 points. So I am on track at this point to do it, but you never know. You could have a bad day. It could be a hard exam. It could be an exam that's more specialized in something you're not the strongest at. You just never know what that exam is going to look like. But like I said, so far, I've been impressed. He asked, am I at Ross? No, I'm at St. James School of Medicine in St. Vincent. So ACCM accredited, cheapest tuition in the Caribbean. And all my professors have been pretty good. Like my neuroscience professor last semester, she was top notch. PhD in neuroscience. She actually had to flee Caracas, but she was at the top medical school there in Venezuela until political strife had gone through. But all of our professors have been really top notch for the most part. A lot of them are from India. A lot of them are from Ukraine. So, they're taking advantage of a lot of talent that's fleeing other areas that are very, very knowledgeable in their subject areas. So after that, so you take, at our school, you do 5 semesters. You take the comp, you have to score a 65, I believe, of raw score on the comp. And after that, they certify you to take STEP, then you take STEP. So after you're scoring that well on comp, you should pass step. It puts you like a 99% chance of passing step one. And then after that, then you go into clinicals, and our main clinical sites are in Chicago, South Texas, and West Virginia, and then you can do electives at other locations. So luckily, having been in healthcare for a long time, I've probably got 65 patients that are physicians, and I know a lot of people through the internet as far as like program directors and stuff. So I should be able to get some pretty good elective rotations and some sub-Is and things like that, hopefully. But yeah, like the main thing that's helped me to land on dean's list every semester that I've been in so far. I can't say that like my knowledge in chiropractic and having worked in healthcare for a long time. I worked in a family medicine practice for almost 2 years. I worked in a sports med outpatient in a hospital for over a year, and then I've worked in an MMA facility, for the last 10 years or so. So I'm not really around medical professionals as much, but we're right next to a hospital. So we've had PMR residents come over from Loveless Healthcare and spend some time with us. We really try to communicate interdisciplinary a lot. But yeah, I think my education previously obviously gives me a big advantage. Being a good test taker obviously gives me an advantage, but I figured out the style of studying that works for me, and that's spaced repetition using Anki cards. But it has to be in my language, the way that my brain interprets it. So I have to make them. I've tried using Anki and some of these other ones. It just doesn't work as well for me because it's not. It's like reading something that somebody else wrote. It doesn't flow the way that my brain flows. So when I see a question that I wrote, it helps me to remember that topic. So when I see an exam, I can kind of work my way through it. I also don't do practice questions yet. I'm sure I'll do UWorld and when I'm prepping for step one. But at this point, it's my opinion that memorizing test questions isn't going to get me ahead. I need to really master all the fundamentals ahead of time. You can't just memorize test questions all the way there. And it's too slow in my opinion. Well, at least for me, it's too slow to go through questions like that. Because a question can take 2 minutes to read, and then you got to spend time, lodging your way through it. I know some folks will just just put answers and then read the answers after that, and that works for them. But again, I think a lot of those folks are already good test takers, so I don't think those strategies would necessarily work as well for Caribbean students or Irish students or any other IMGs that are coming from the US that are probably going to international schools, likely because they didn't have great MCAT scores. So that's my advice for whatever that's worth. It's probably not worth a whole lot because everybody's different. But for me so far, what's worked the best is just, using the PowerPoints, the slides, paying attention in class. And then if there's a topic that I'm having a hard time with, there's certain little topics that don't stick all that well, right? Like for me, it's like clotting cascades and stuff like that. It's just these arbitrary numbers that kind of run around. Like for me, I've got to do flashcards, and I've got to make flashcards out of those things to get them to stick to where my brain is familiar with them. If I don't know a topic real well, then I'll jump on YouTube and I'll watch a video. So there's a bunch of great channels out there. One of them I really like is Medicosis Perfectionalis. If you guys have seen that channel, it's pretty good. I subscribe to the premium membership there just so I can kind of get those videos. Dirty Medicine makes really good videos, especially for biochem. I found him to be very helpful for my my shelf exam. And I didn't run the calculations exactly, but I think my neuroscience was in like a 99th percentile, which makes sense. Again, I'm a board certified chiropractic neurologist, so I was scoring 15 points, 16 points better on the quarterly quizzes than anybody else in my class. I was getting 98s, 97s, and the class average was running 57, 60. I probably could have taught that class, to be honest. So for me to get an 87, I was actually hoping to score in the 90s raw on the neuroscience exam, but there was quite a few embryology questions, which isn't my strong suit. Hopefully there's not too much embryology on step one, because that might be, we were talking about, what does the exam look like? Is it going to be bad for you? That could be something that runs me afoul. Oh yeah, I said, somebody had asked me about the scholarship. So like, at my school, there's a bunch of scholarships you can apply for. So you can look these up at sjsm.org. I think if you score a 515 on the MCAT, you get a full ride scholarship for basic sciences. I think if you score 505, you get like a half tuition discount. And Yeah, I'm not sure exactly what the other requirements are, but if you're a healthcare professional, you'll get like a semester scholarship. If you get an advanced degree, so I have all of those. I have a master's in exercise science. I have another healthcare degree, so you can pick up scholarship money in all of those. And if you have a 3.6 GPA in your last degree, which obviously I had, there's scholarship money for that as well. Um, I think my cumulative at this point, I had a 4.0 in neighborhood school. My last master's, I think I had like a 3.85 or something like that. So I think my cumulative is like 3.7 maybe previously. So I qualified for all of those as well. Um, and then at our school, if you score in the top 5 of your class in the raw NBME, for the ones that have the NBME exams, you can earn $750 credit towards your tuition for each of those exams. So this last semester, I got all 3 of them for my class, obviously. So that's $2,250 towards my next semester tuition. And the tuition's only $9,000 in St. Vincent. So you could really, if you do a good job and you stay ahead of it, you can really you can really minimize your student loan debt in becoming a physician. Um, so that's something I'm very grateful for St. James for having these opportunities to perform well and then also be rewarded for it. So that's pretty cool. And also, like, I have to say that I've been able to like get a hold of the deans and the faculty and the folks in Chicago who run the school. Like, the communication's been fairly easy. I never have a hard time getting a hold of them. So the benefits of the school obviously is you can get in 3 times a year. You don't have to wait. For me, they accepted my old basic science credits. For me being an older student, I'm 41 now in my second year of med school. I graduated chiropractic school at 26. So, I was pretty young. So I think all my basic sciences I took when I was, 19, 20, 21, which has been a long time. And actually science has changed somewhat since then. Like, in some of these classes, there's like a few new things, like particularly genetics. Like, a lot of genetics has changed in that amount of time. But there's some biochemistry stuff as well where I'm like, wait, I don't remember that. And it's because like there's been scientific advances, quite a bit of it in the last 10, 15 years. I graduated chiro school in 2010. Um, so my basic sciences are from I graduated undergrad in 2006. So I would have to take my organic chemistry, biochem, gen chem, all those, general physics again, if I was going to try to apply to a U.S. school. And I think they moved it to 7 years now is how far it goes back. But for me, that wasn't an option either. I'm not going to go spend 2 years of my life, sitting in undergrad classes or community college or wherever just to take classes that I already got A's in a long time ago. So for me, the speed to get into the program was a very important factor. So that the ability to still utilize my credits from my previous degrees, and then having 3 rolling cycles a year, those were the big things that made me go towards this. And the reason I started looking at St. James in the first place was the tuition. I do want to do this, but I'm not really willing to put $300,000, $400,000, $500,000 into it, because I have a profession, a good paying job that I make a lot of money in, to be honest. So it would have to be something that was affordable to me. A lot of other students don't have that fallback that I do, where they can just go back to their job and make 6 figures, no problem. So they have to go all in. And I understand why some of the students go to schools like, the Big Four or whatever. They do have more graduates. So because they have so many more graduates, they have more connections into certain residency programs. But that comes at a cost, right? You're gonna have to pick up $400,000 or $500,000. And so you have to kind of decide, which of those things are more important to you. And for me, it's like I have connections. I can meet people. I'm obviously an outgoing person. I don't need to rely on the school to make me connections necessarily. And so if that's the case, then I don't want to pay the extra amount of money. I want to do this as affordable as possible. And St. James is the school that really stood out to me. And so far I've had nothing but a great experience. I really can't complain about anything. I mean, the things that I could complain about, that's just med school, right? Like, it's just, you're getting your ass kicked. Sometimes they move exams when you don't feel like you don't have the time to study. And then some of the, trials and tribulations of just not being in America. But luckily I've had experience not living in America before. Like, I did my sports med internship in chiropractic school in Colombia. So I lived in Bogota for I think about 5 months before that. So I've lived in other countries before, so that wasn't super foreign to me. And comparatively, both Anguilla and St. Vincent are a lot more Americanized per se than Bogota was. So obviously the language, they both speak English, um, but like the types of things you can buy in the grocery stores and things of that nature, those islands are a lot more American, which of course makes sense. You know, they're um, more trading partners with the U.S. than South America, obviously. Um, so yeah, so those have been some things that I've been dealing with so far. Yeah, so somebody asked how school's going. Yeah, it's good. It's fine. There is definitely some attrition, obviously. So you know, some of the folks that don't belong in school, they don't make it this far. They're not making it to the second year. Um, for better or worse, that's just it is what it is, right? That's just how these Caribbean programs work. Like because they're a little more lenient and accepting, they're going to have some people that don't pass, and that you know some of their tuition is part of what's keeping the schools open to give the rest of the people an opportunity. You know, all the schools can do is give you an opportunity, right? They're giving you an opportunity that you didn't have otherwise. So you have to look at yourself in the mirror realistically and say, am I going to be one of these, you know, one of the top 40% of the people in my class, the top quartile, that is going to score well, that is going to pass my step, that is going to make connections. Um, and a lot of people, of course, lie to themselves, but you have to be realistic. Like I said, you can't be scoring 15, 20 points below the national average in NBME and think you're going to pass step. You know, you need to be at least within 5 to 10 points every single time. Um, or in my case, you know, you want to be, I'm trying to shoot 15 points over every single time. That way I know I'm on track. But these schools, like I said, they give you the opportunity. Like if you want to be a doctor, this is, you know, this is the last chance for a lot of people. And schools like St. James are the schools that really provide you that opportunity. So for that, I'm really grateful. But yeah, we've had some attrition. So now my class is stacked now. There's not a ton of people left in it, like from where we started. My original class, because I had to take an LOA because we had some health issues. But this class had 20, I think 25 in them. And now I think we're down to 15 or so. So, but the students that are left in the class are really smart. They're studs. So I think just offhand, we have a pharmacist, we have a speech language pathologist, we have a behavioral therapist, we have a critical care nurse practitioner, we have a PA, we have a massage therapist, we have a pathology assistant, and then two of the younger students have worked in the hospital, you know, in the ER for a long time. So the folks we have left are really specialized in their knowledge. So, and you can see that in certain classes, like the pharmacist is like really good at biochem. I'm sure she's going to crush pharmacology. You know, the massage therapist was really good at musculoskeletal anatomy. So was I, obviously. For me, it was neuroscience because, you know, like I said, I'm a board certified chiropractic neurologist. The pathology assistant is obviously killing pathology. We have another lady, she has a master's in research and she's worked in like micro labs. So she's really good at like biochem and microbiology. So like the students that we have left are really good. I think, you know, I would guess at least 80% of these folks are going to match. And most of us are kind of going into very niche specialties and all primary care type specialties. So like we have like psychiatry, internal med, family med. That's kind of where a lot of us are aiming. We're being realistic about like where we want to go. For me, I'm looking at the main three. The main one I'm looking at primarily is ONMM, but I'm also looking at neurology and PMR also. You know, many chiropractors that go back to med school go into PMR. I know probably 6 or 7 chiropractors that went back to med school and went into PMR. It's a very, you know, clear and straightforward path to do that. It makes a lot of sense. It's something they were already interested in. But a lot of them just wanted to expand their scope and do more things and become physicians. I also know somebody who's a neurologist, which is ironic because neurologists generally don't like chiropractors. But I know at least 2, if not 3, chiropractors that ended up being neurologists later on too. So those are kind of the 3 specialties that I'm looking at the most. You know, if things don't work out and I have to scramble into internal or family med or something like that, that's fine too. I have a lot of interest in medicine, generally speaking, but for now, those are the kind of the 3 specialties that I'm looking at. I have a particular interest in manual therapy, so osteopathy is the thing that really intrigues me the most. But all 3 of those fields are sort of interlinked. So we'll see what happens with rotations. We'll see what happens with sub-Is. We'll see what happens with electives. We'll see what happens with audition rotations and things like that. You know, I was able to do an audition rotation-ish with a program that I really like a lot. So that's, you know, right now they're number 1, obviously. But I guess we'll kind of see how things go after that once I actually get into my clinicals and, you know, if those programs are still have the people there, the same program directors, the same attendings, and their philosophies are still the same. So I don't know. We'll see. There's a lot on the table. I mean, there's no guarantee I'm going to finish the program either. Life comes at us. We never know what's going to happen. But as of now, that's kind of what I'm aiming for. So yeah, if you guys are watching, drop some questions in the comments. I'll do another live. We'll go over this stuff. Yeah, if you guys are interested in my school, St. James School of Medicine, sjsm.org, go check them out. I'll link them below as well. I've had a few students that have come through that have seen my stuff, seen my interview from before, and I've kind of able to point them in the right direction. So that's some of the stuff that I'm answering on this. I know a lot of people are curious about like the path from chiropractic to medicine. I think I talked about that in a previous video. I say too much in these videos. You ever notice that? Neuropathy, we can get into that. Yeah, so drop some questions if you guys have questions about like the islands or the med schools or the specialties, or if you have generalized questions about chiropractic or naturopathic or being a YouTuber. Yeah, I could probably answer a lot of those things. So I'm looking for topics to get into a little bit. I was thinking about doing some lecture type material, but I'm not sure that this is the format for that. If you guys, maybe my OG, you guys used to watch my lectures. I've taught doctoral students for almost a decade now. So I used to broadcast my, right around the same time Jordan Peterson started, I would broadcast my biomechanics lectures and my sports med lectures back in the day on my Instagram live, and I would put them up here on YouTube as well. I think I put them on a different channel maybe. So that's a format I'm comfortable with. I probably just don't have time to do that right now. Obviously, I have a lot of exams. I think I have 4 exams next week, so I got to kind of, like I said, it takes time. It's just a time thing. It is what it is. It's med school. You got to put in the time. But if you guys have any other ideas for the channel, you have questions, anything, drop them in the comment below, and I'll catch you guys in the next one.